Hello, everyone, and welcome to today's presentation, which is part of the series of webinars provided by the Division of Public Health section of Chronic Disease Prevention and Health Promotion. The primary aspects of our work include health promotion, chronic disease and injury prevention, and data collection and surveillance. This webinar series was created to provide a forum where we can talk about specific projects and explore ways to collaborate. We will be offering webinars on the third Tuesday of every other month at 1 p.m. In addition to sharing our work with you, we hope these webinars will spark your interest in learning more about our projects and explore ways for further collaboration. Another way you can stay connected to our work is through our newsletter. You can sign up for the newsletter on our section's website. Our website address is on our slide presentation. There are a few housekeeping items to go over before we start. If you are listening by phone, please keep it on mute. Also, please do not put this call on hold. If you receive a call, please hang up and call back in. The webinar is planned for 30 minutes, a 20-minute presentation followed by 10 minutes of questions and answers. A recording of today's webinar will be sent to all participants, and the slides will be made available within the next week. Audio for this webinar will come through your computer. Another option is to call the number provided when you registered for today's session. If you have technical difficulties, please let us know by using the question function on the GoToWebinar control panel. To ask a question, you will need a microphone on your computer, or you will need to call into the number provided when you registered. Please hold all questions until the end. And to ask a question, raise your hand by clicking on the hand button in the control panel. Today, you will be hearing from Terry O'Connor, Chief of the Section of Chronic Disease Prevention and Health Promotion, and Andrea Finati, Deputy Section Chief. They will be sharing the section's new strategic plan and discussing how the section worked with partners before finalizing it. Thank you, Terry, for starting our presentation today.
Thank you for joining us to hear about our section's new strategic plan, which will cover the state fiscal years 2018 through 2022. As Ann mentioned, Andrea Finati and I will be presenting today, and we will be switching back and forth throughout the presentation. Here's a summary of what we plan to discuss with you: the background of the plan, the purpose and assumptions that we used, the process we used to develop the plan itself, the goals and strategies, and then how we intend to implement it. Those of you who are familiar with our section may remember that our last section-level strategic plan spanned state fiscal years 2013 through 2017, so we were due for an update. These are the section's mission and vision. Our vision, healthy and safe Alaskans. Our mission, to prevent and address chronic disease and injury so that Alaskans live longer, healthier lives. I'll note that we updated the language of our mission since the last plan, keeping the intent the same but making the language more succinct. And then finally, to accomplish our mission, we collect and share data, we use and promote effective strategies, we enable communities to protect health, and we provide public education that empowers Alaskans to live healthy lives. Before we start discussing our new plan, this is just a quick recap of our fiscal year 2013 through 17 strategic plan and the progress we made towards meeting the goals we set. These are some preliminary results as we're still compiling the final year's worth of outcomes. The goals are in the left column and included reducing the prevalence of overweight and obesity among school-age children by 5%, increasing screening rates for selected preventive screenings, shown here in the columns further to the right, by 5%, decreasing the rate of hospitalizations due to falls among adults 65 and older by 5%, and reducing smoking or smokeless tobacco use prevalence by 5% for specific populations, shown here in the columns to the right. We saw varying degrees of progress during a time when there were substantial funding challenges and transitions for our programs. I'll also note that we had specific targets identified, so in some cases where the goal was not met, the outcomes improved but fell short of meeting the goal. This has been the case so far in looking at smokeless tobacco use among Alaska Native adults, where there was improvement that was falling just shy of meeting the goal when we looked at the most recent 2015 data. I'll also mention this specific example regarding our goal to reduce the prevalence of overweight and obese adolescents. This is one of 4 indicators we use to measure this goal. The baseline for this indicator, which looks at the percentage of Alaskan adolescents who are overweight, was the 2011 value, 14.4%. In 2013, the strategic plan target, 13.7%, was actually met, but it ticked back up again in 2015. Goal 5 of our previous plan was more process-oriented, as well as more cross-cutting across the section's programs. Here are just a few examples of activities and outcomes to summarize progress made under this goal. You can see one of our activities here was to implement a quality improvement process to improve performance, and one outcome was that the section developed and implemented guidelines to make more effective use of meetings. Another activity was to implement changes to improve the integrated communications group in our section. An outcome of that was development and sustained implementation of this webinar series. So similar to other plans, we intend to use our new strategic plan to set priorities, focus our resources, and set shared goals towards which staff and partners can combine efforts. As we look forward to the next 5 years, we considered the best way for a section-level plan to add value, and decided this time to focus the plan to improve how we achieve our public health goals, rather than which public health goals we should try to achieve. This is not because our public health goals are not important. They're the reason our programs exist. But considerable energy from our staff, partners, and leadership has already gone into defining many of our public health goals. One example of this is Healthy Alaskans. This is a process that many of you likely participated in. Healthy Alaskans includes 7 leading health indicators relevant to our section's programs, and those are outlined in red here. So for example, on the top left, reducing rate of deaths due to cancer. Next one down, increasing the percentage of adolescents who don't use tobacco, and so on. In addition to these specific goals, surveillance data from our section are used to measure over half of the 25 leading health indicators that make up Healthy Alaskans. Similarly, the Division of Public Health Strategic Plan includes several areas of importance to our section in Alaska's Winnable Battles. These include decreasing tobacco use, decreasing colorectal and cervical cancer, increasing the proportion of children who are at a healthy weight, and decreasing childhood poisonings. Finally, many of our programs have worked with their stakeholders to identify their own public health goals. Just a few examples of this, looking left to right, are the Alaska Comprehensive Cancer Control Plan, the Heart Disease and Stroke Prevention Plan, and the Tobacco Prevention and Control Strategic Plan. The section developed this infographic several years ago to illustrate the interrelationship between health behaviors or risk factors listed on the left and chronic diseases listed on the right. These relationships underline that we achieve more when we work less in silos and more by integrating our work across programs. So again, given all the time and thought that so many have put into developing public health goals, when we thought about doing a new section level plan, we chose to focus on improving how we do our work and finding ways of improving that work across program areas. Now I'll hand off to Andrea.
Thank you, Terry. So we wanted this new plan to be strategic and to focus on improving how we do our work and finding ways of improving that work across program areas. We also wanted to be sure to include input from our partners in a couple of different ways. First, we needed to do a temperature check with our partners. What have we been getting right? What could use improvement? To answer these questions, we conducted an online SWOT analysis in November of 2016 with our key partners to look at strengths, weaknesses, opportunities, and threats. Once we had developed our strategic plan, we also wanted to be sure to again reach out to key partners and get their feedback on the extent to which we got it right or missed the mark. This was done in April of this year, again via an online survey. Now I'll briefly share what we heard from partners through the SWOT analysis. Later I'll get back to the feedback we heard on our draft plan. Here's what we heard from partners about our strengths and weaknesses as a section, as well as perceived gaps. First, strengths. Partners noted the section does a good job of collecting, analyzing, and disseminating data and summary statistics to partners. They also described the section as having knowledgeable and engaged subject matter experts. One recurring theme was responsiveness. Also, partners felt that the section effectively collaborates with partners and values external partnerships. As for weaknesses, partners indicated some challenges with accessing CDPHP websites, resources and materials, and data. For example, documents might have had too high of a reading level, Some websites were outdated, and we don't have a large enough social media presence. Partners also noted room for improvement in several areas of communication. For example, we could do a better job of communicating challenges and threats with partners, of seeking help from partners and contractors when our capacity is limited, and of public outreach in general. Also, partners indicated that the section needs to do a better job of forming partnerships with organizations and groups outside of our walls, including healthcare providers. Finally, the gaps that were identified fall pretty directly from the weaknesses already mentioned. More collaboration, more outreach, more timely data dissemination, and better use of that data to establish ourselves as credible public health experts. As for external conditions that can either provide opportunities for or threaten our ability to reach our objectives, here's what our partners said. Noted opportunities included positive movement in the area of some social norms that support healthy choices, and strong partnerships with a special shout out to Healthy Alaskans 2020. And partners saw the following threats, including Alaska's fiscal situation, a changing federal climate, and distrust that many Alaskans have of anything connected to the government. So we took all of that partner input, added it to our own section SWOT results, and considered all of that in the context of the existing section plans, as well as alignment with the division and department plans and priorities. From that, we ended up with 6 goals and supporting strategies. The first, and these are in no particular order, is related to data, to improve timely access to useful, quality public health data and information. The supporting strategies for this goal include enhancing our online data dissemination, providing more TA to both end users and also data providers, and ensuring we have a sustainable system for continuing to collect, analyze, and disseminate data into the future. The second goal is about communication, or more specifically, public education. The goal is to expand public education efforts to change knowledge, attitudes, and behaviors to improve health. Supporting strategies are to use public education approaches, such as social marketing, that have been shown to be effective, to increase engagement with partners to maximize the reach of our messages, to increase access to public health data and information. And I'll just note, this is one of many places where you'll see the goals and strategies of this plan are interconnected. And develop and share messages in a way that will resonate with the intended audience, whether that's the public or decision makers. The next goal is intentionally broad and covers aspects of the 10 essential public health services that are not specifically addressed by the remaining goals. So goal 3 is to ensure programs use evidence-based approaches that improve quality of life for Alaskans and reduce health inequities. Supporting strategies include relying on public health data to monitor health and sharing reports and recommendations with partners, the public, and decision makers. Relying on evidence-based strategies in our work, and evaluating our programs.
Goal 4 is to strengthen programs and policies that improve outcomes for chronic diseases and unintentional injuries. Supporting strategies here include seeking new funding for chronic disease and unintentional injury programming. Note that we specify Alaska programs that address those issues, and this is not just for programs in our section. Communicating about health effects, costs, and evidence-based strategies, the right information to meet community needs, and sharing that information in a way that resonates with the intended audience. Goal 5 is to maintain a highly professional, competent staff of public health leaders capable of providing leadership, expertise, and continuity to public health, chronic disease, and injury prevention efforts statewide. Supporting strategies here include improving the way we orient and incorporate new staff, providing professional development that enables staff to be effective, and promoting an internal culture that supports collaboration and cross-training. Finally, Goal 6 is to expand and enhance external and internal partnerships and collaborations to improve the collective impact of our public health work. Supporting strategies include improving our ability to support and benefit from the work of our partners, as well as other internal programs. And this is not just for the sake of collaboration, but in order to advance all of our work.
So once we developed our goals and strategies, we solicited feedback from partners via an online survey. Here's what we heard. Across the board, about 3/4 or more of partners thought that the plan addressed the barriers in each of these goal areas well, with most saying it addressed them very or extremely well. The staff competency and development goal had the lowest ratings, but it also had by far the largest percentage of people saying they couldn't really say whether the strategies address the barriers in this area, likely because these are more inward-facing barriers. We also asked for comments from partners related to each of the draft plan's goal areas, and here are some of the themes we saw. For the data goal, we heard that we still need to improve the user interface and accessibility of our online data, as well as some kudos. Regarding the communication goal, we heard calls for more cultural responsiveness and also increased collaboration. Related to public health approach, we received a question about how to move forward when best practices were limited, and also a call to focus more on cross-cutting risk factors and less on specific conditions. For the policy and funding environment goal, we got a question: will we really be able to seek alternative sources of funding? Some partners expressed willingness to help with the staff competence and development goal. Some also questioned a strategy we initially had about maintaining a work-life balance and how tied that would be to improved outcomes. Although we do as a section agree on valuing work-life balance, we also heard the feedback that our strategic plan document may not be the best place to call this out, and so we removed that specific strategy. Finally, with regard to the collaboration and partnership goal, partners advocated a whole person approach and suggested outreach, including travel, to enhance outcomes in this area.
And here are just a few examples of how we will begin to implement the strategic plan in FY 2018, which is our first year. This list includes some activities that are likely to be more visible to people outside our section. Other activities not listed here may not be as obvious to an external observer initially. One example is updating our employee orientation process. We don't expect that our partners will necessarily be involved in this activity. But what we hope is that you'll ultimately see that our new staff members you work with are better able to contribute to shared work more effectively and or more quickly after joining our section. Our new strategic plan is already posted online. If you go to our section website, which is at the address listed here on this page at the bottom left, it's under our news and announcements section in the center. Or you can type in the web address also listed at the bottom to go directly to the plan. And with that, we're at the end of our presentation. We really appreciate your joining us, and I hope we've provided some context for how we plan to work with you, our partners, to prevent and address chronic disease and unintentional injury in Alaska, including some specific activities we'll be reaching out to you about over the next year. I also hope that you can see how your input was reflected in our plan. If we don't get to your question today, you're also welcome to follow up with one of us later using the contact information on this screen. And we're now open for questions. If you do have a question, please follow the directions on the slide that you see here to enter your question.
So we have one question, who are our partners? It's a list that's been developing, folks that we have partnered with outside of our walls. So some of those include governmental partners outside of the section, as well as partners, non-governmental partners. So it's been a list that's been growing over time.
But the question is, can we get a copy of the slides? And we are recording this webinar, and it will be posted on our website in the coming weeks. And am I correct in saying that anybody who participates would get a follow-up?
Yeah, this is the info template with the section. About a week after this happens, we post the actual PowerPoint as well as the recorded webinar on our website, and we send an email announcement to everybody who's registered for the webinar, whether they actually participated or not. So please look for that in the coming days.
Another question is, how often will we report on progress to the plan or update the plan? I think we're still working that out internally. I think we would report it more frequently to our staff who are working on the plan, and some immediate partners who are working on activities related to the plan. I think we're still figuring out how often we're going to report on progress, and I think we'd appreciate your feedback and your input about how often you'd like to hear from us.
There's a question about how do we include youth feedback in programs that target youth, and I think that's a really good question. I think a lot of the details of how each of these goals and strategies will be moving forward are in the process of being worked out by separate groups within our section. So that will be something to make sure that we consider as those groups develop their more detailed work plans.
The next question is, are other sections following a similar process-oriented approach in an effort to break down silos? And I'm not sure that we can answer that question. I know the section of Women, Children, and Family Health has recently been working on their strategic plan, and I haven't seen that yet, but we can ask them and follow up.
So it looks like this person has their hand up. So I'm going to unmute them.
Mm-hmm.
Hey, thanks, Terry. This is Jerry Trushinsky. Nice job. When you're talking about communicating the benefits of all the data that you provide, I'm wondering if you guys have given any thought to recruiting a health economist. I think in terms of the division-wide, we might be a little bit weak in health economics, and I think maybe talking more about cost-benefit would be helpful to some policymakers. What are your thoughts on that?
We agree that would be really great really great data for us to have. We're not really at the point where we can do something like that at the moment, but I think if there was interest in other sections, we could explore that in as we move forward. Great idea, though.
Okay. Thank you.
So this one has the I can use as well.
Mm-hmm.
Rhonda Johnson, please go ahead.
Oh, I actually posted my question in writing, so I'll put my hand down. Thanks for a great presentation.
Thanks for being on.
So another question that's sort of a follow-up to what we heard in some of our partner feedback around increasing cultural competency, cultural sensitivity, cultural humility. As far as what approach we'll be using, again, that hasn't been identified yet, but the work group that is taking that on, and that might cross-cut some of the goal areas, we'll definitely be exploring what the best practices are there.
I think that's all the questions we have today. Like I said, we will be posting this webinar as well as the PowerPoint presentation online, and we will let all of you know when that's done. And we thank you so much for your time today. And we will be ending the webinar now. Thank you.